Technotherapy is about transforming the relationship between people and their healthcare providers. And we see that the key to that is providing really high quality training to healthcare providers on how the use of mobile and web changes the relationship with their clients. It's a kind of a complicated new world out there, and especially healthcare providers that deal with a lot of regulations and complexity. They want a way to really understand, how does this change what I'm going to do? And so that's really what our training's around. And it ties into essentially clinical psychology, really understanding how it changes the dynamics between the provider and the client when you have a mobile or web device keeping you in communication.
Hello, I'm Yvette Torres, and welcome to another edition of The Road to Recovery. Today we'll be talking about using new technologies to expand treatment and recovery services. Joining us in our panel today are Dr. H. Westley Clark, Director, Center for Substance Abuse Treatment, Substance Abuse and Mental Health Services Administration. Let's talk a little bit about workforce issues. How can we promote the use of these technologies, and what needs to happen within the field to adopt these technologies?
Well, one of the most important things is getting clinicians in the community to recognize the utility of the new technologies as we approach the clinical care and our interactions with the consumers who present to us. So there's a group called Technotherapy, and what they've been doing is trying to educate community providers about the psychology of cyberspace, about how perceptions are changed and altered, and about a number of the psychological dynamics associated with being online, and how important it is for the workforce to understand those issues, because when you're interacting with your client, with your patient, and you need to be asking about their online experiences, because it does color how they respond to various issues and various interventions. So that, I think, is an important thing. We need to make sure that we're diffusing this information. And SAMHSA has a portfolio where we're trying to promote that, so people understand that a new environment requires a new way of looking at things so that we can enhance our effectiveness.
What do you see in the future, and what are your last thoughts?
Making sure that, as Technotherapy is trying to do, making sure that we have a workforce that is sophisticated in the use of health information technology and the impact of social media on individuals, their access to social media, and making sure that consumers make the proper choices in terms of how they participate, both as a reactive, in a reactive mode, as well as in a therapeutic mode.